External features of the heart. Well, in this section, we will talk about the major surfaces, borders, the base and the apex of the heart. And then in the next part, we will move on to the interior of the heart, talking mainly about the interior of right atrium and right ventricle. To understand the external features of heart, let's draw a very simple and schematic picture for that. So let's say this here is the right border, the vertical right border of the heart. Here is the inferior border, the apex and the left border. As we know, superior vena cava and the inferior vena cava, they're entering along the right border only into right atrium. So this clearly here, this is the right atrium. That is the superior vena cava and the inferior vena cava, which lies along the right border only. This, let's say, is the coronary sulcus, which is a demarcation between the atrium and the ventricle. So this here is the right atrium, and below we have ventricle. So this is the right ventricle. So you can see the major part of right atrium and right ventricle from the anterior surface or the sternocostal surface. You can see part of left ventricle along the left border, and left border is also made up of not by the right atrium but by the extension of the left atrium called as left auricle. So you will see the extension of the left atrium extending along the left border, that is called as a left auricle. That is left auricle, not atrium, that's auricle. So talking about the surfaces, the borders here, so I can clearly say that the right border of the heart, and guys, we are not talking about the cardiac shadow. If we say right cardiac shadow, then we have to include the superior and the inferior vena cava also. We're just talking about the right border of the heart. So right border of the heart is just by the right atrium. Inferior border or the lower border, predominantly it is by the right ventricle, but it is also having a contribution from the left ventricle, a small part by the left ventricle also. Left border of the heart predominantly is by the left ventricle, and it is contributed a little by the left auricle in the upper part. So this first thing that is about the borders here, the right border, that is about by the right atrium alone. Inferior border is by the right ventricle and left ventricle. These are the kind of thing you have to remember from the pictures only, from the diagram itself. If I simply say what tell you the border of the right border, left border, inferior border of the heart, it is a bit difficult to imagine. But once you draw it, it's very easy to comprehend that which chamber is contributing to what border here. And the superior border, which I'm not marking here, the superior border is an oblique border again, which is mainly by the right and the left atrium, mainly by the left atrium. Base of the heart. Base is what surface? Base is the posterior surface. Base is not the diaphragmatic surface. This is not the base here. The base of the heart is on the posterior surface, and base is contributed by the right atrium along with the left atrium. Both right and left atrium are forming the base, in which left atrium contributes to the 2/3 of the base and right atrium contributes only 1/3. You can see the majority of the right atrium can be seen from the front. So only we have some part of right atrium behind. But I cannot see any part of left atrium from the front because it is only left auricle can be seen. So major part of the left atrium is present behind, and that is the one contributing to the base. So they did ask this question even once, that base is by what chamber? They asked the ratio, that how much part is by the right atrium and how much by the left atrium. So 2/3 is by the left atrium. And this here we have the apex. Well, without a doubt, apex is just by the left ventricle. It is by the left ventricle, and the location of the apex is very important for the apical beat. The apex of the heart lies in the left fifth intercostal space. It is present in the left fifth intercostal space, 9 centimeter away from sternum. Or you can say just lateral to mid clavicular line. You can say lateral to mid clavicular line, or you can say 9 centimeter away from the sternum. So that's the location for the, or that's the surface marking for the apex. Left fifth intercostal space, 9 centimeter away from the sternum. So guys, this is a bit about the surfaces and the base and the apex of the heart. The two chambers that we'll be discussing in the next part will be the right atrium. So we'll be discussing the detail of the interior of the right atrium, and then we'll close the right atrium and we'll look into the right ventricle also. So first, let's start with the interior of the right atrium.